working to address health disparities. I'm Jill Horner. This is Comcast Newsmakers. With me this hour is Jamahal Boyd. He is the director of the Office of Health Equity for the Pennsylvania Department of Health. Thanks so much for being with us.
Thank you for having me.
Let's talk a little bit about the role of your office and how you actually work to address health disparities and inequities.
Well, the office was established back in May of 2007 by an executive order from Governor Rendell and former Secretary of Health, Dr. Calvin Johnson. And the state has always dealt with health disparities issues or minority health issues, but the official establishment of the office have given us an area where everything is coordinated around development of policy or working to develop policy, creating programs and providing resources and services to our stakeholder groups in effort to try and partner with or leverage resources to eliminate health disparities over the Commonwealth of Pennsylvania.
So let's focus on what these disparities include and some of the barriers that people face in accessing health care.
They're significant, and they touch all of the Pennsylvanians. It could be from language access to physical access of a facility, or the number of physicians that we have providing services to minority or disparate populations. The list can go on, and it's not a racial or an ethnic issue. It's more or less a disparity, or where a group is more disproportionately impacted by a health concern. Health disparities impact us all.
So it could be everything from a lack of transportation to a lack of primary care physicians in parts of rural Pennsylvania to language barriers.
Yes, absolutely. Absolutely. The list is very wide, and I think that that's more the reason why the state and the country is moving in a direction of trying to create equity, because it's not just working with those who are more disproportionately impacted by health disparities, but trying to address the health inequities that impact us all.
And this is actually part of something that's happening nationally. You run the office here in Pennsylvania, but talk to us a little bit about the National Partnership for Action.
Well, the National Partnership for Action is a group that is comprised of all of the states that have an Office of Health Equity, Office of Minority Health, or Office of Multicultural Affairs, or a lookalike. And what we do is we work with that organization to provide resources and information, inform them, or provide guidance around what happens in our local area. On a national level, we come together to inform policy recommendations as well as programmatic recommendations or funding dispensation. We also work with the Office of Minority Health out of the Department of Health and Human Services to use that same data to inform a lot of what is going on a federal level.
So having this national conversation, there's actually a conference coming to Philadelphia in November. This is the National Health Disparities Conference. Why is this national discussion coming to Philadelphia? Why is it important to have this discussion in Pennsylvania?
Well, it's important to have this discussion in Pennsylvania because Pennsylvania looks pretty much like the country. You have those two major metropolitan areas on each end, and then that large rural mass in the middle. But I think that a lot of the work that we're doing here in Pennsylvania and what we're looking to do is going to be best practice driven, and as well as this is a great platform with the work that we're doing around the Commonwealth for health disparities elimination to inform or be the place setting, I guess, for such a discussion.
And that is an exciting opportunity for people in your line of work. You actually host events throughout the year in order to reach out to the public, but do you actually hear from the public as well when they have a concern related to some of the barriers they may face in healthcare?
Absolutely. Our constituent groups range from academic institutions, hospitals and health systems, insurance companies, community and faith-based organizations. We work very closely with them, not only to take issues that they bring to us, but to also provide guidance. I sit on a lot of advisory boards, as well as provide information and resources or data to help them when those concerns are raised. And we try to make sure that we are the voice for health equity, and that's why we look to develop capacity or build collaborations with those organizations so that then we can make an impact or have change.
Thanks so much.
Thank you.
We've been talking with Jamahal Boyd, the director of the Office of Health Equity for the Pennsylvania Department of Health. I'm Jill Horner for Comcast Newsmakers.